Hey everybody, this is Jeremy Paul's 2010, and our teacher asked us to discuss a facet of consumerism, and since I had already brought up the iPad and its use in the medical field, I thought I would continue along the same vein, as it were, and talk about the pharmaceutical industry. So a couple of things that I'll be discussing during the course of this video log is promotional dollars versus research and development dollars. I'll be talking about global spending and the U.S. percentage of that spending, the increase of pharmaceutical sales within the past decade, an inherent problem with lack of research and development, the NDM1 gene and bacteria, drug-resistant pathogens rather, and as well as some legislation and countermeasures that are being introduced in order to fight the overuse and misuse of antibiotics. So the first thing, of course, was to discuss promotion versus research and development. And evidently, the study found that the U.S. pharmaceutical industry spent a little over 24% of it's a little over 24% on promotion versus a little over 13% on research and development. Now, this percentage is a percentage of domestic sales in excess of $235 billion. So even though these are large numbers, it's still that the promotion is almost double that of research and development. And the reason why this study focused on the United States is for two reasons. One, for the ease in which you can find information, find out information about the sales in U.S. And the United States, as well as the fact that the United States constitutes 43% of global sales and global promotional expenditures. The study also found that the number of meetings for promotional purposes jumped dramatically in 1998 to 2004, from approximately 200,000 meetings in 1998 to a little over 370,000 in 2004. So the next thing, of course, is since marketing directly impacts sales, the next thing would be to talk about the efforts and the what happens, the results. So in 2006, the global spending of prescription drugs actually topped, get this, $643 billion. The U.S. constitutes a little over half of that, with $289 billion, which goes with the 2004 study. 2004 study that U.S. is about half, a little less than half, 43%. But what I actually want to introduce real quick, and we can maybe talk about this a bit later, is the fact that with the advent of the baby boomers becoming aged and in their health decline, that I believe that these numbers are going to actually increase. So in the U.S. alone, prescriptions have increased over the past decade to 3.4 billion annually. This is a 61% increase over the last decade. Retail sales has jumped. They have jumped 250% from $72 billion to over $250 billion. And while the average the average cost of prescriptions has increased over the past decade from $30 to around $68. So a couple of things else. Let's see here. The real problem that I think, because they're not spending as much money on research and development, and most of it's going in promotion, which is arguably quite effective, is that the more money spent on marketing than research and development, it kind of hampers the ability for the pharmaceutical companies to create an effective antibiotic quickly, with a growing menace of antibiotic-resistant drugs. Antibiotic-resistant pathogens, rather. So what they've discovered is that most pharmaceuticals have either slowed or even halted their research and development. One of the reasons why I've found during the course of my research is that the FDA actually only approves about 25 new drugs a year. So if a pharmaceutical company dumps a bunch of money into the production of a drug and it isn't approved, they've basically wasted all of this money. So it may not be seen as advantageous to them to actually dump their money in research and development and just dump it all into promotion to sell the products that they do have that are approved and available. One thing that they've noticed, though, is that small biotechnology companies are actually filling the void for research and development. Now, whether or not these companies are subsidiaries or independently owned and operated, I have no idea. But these biotechnology companies are filling the void for research and development, and I would think that this would actually, buffer, the liability of the larger pharmaceutical companies, against any risk or loss of funds. So from there, since we're talking about we've talked about antibiotics and whatnot, it's pretty alarming that there's a new gene that's out there. It's called NDM1, and it confers major resistance to antibiotics, especially to a class called carbapenems. What's most alarming about this is that these class of antibiotics are a last resort against bacteria that have already that already have resistance to standard drugs. This gene started, they found, in Bangladesh, India, and Pakistan, and that, but it's starting to be found in other countries, Britain and the United States, because most notably because of the medical tourism industry. Evidently, it's often it's cheaper for people to actually go out of country and get these elective cosmetic surgeries in any one of these countries, especially India, than getting it in their own country. So what they're finding is that these people that have gotten these elective surgeries are coming back and they have the gene and they're infected with it, and it's incredibly resistant to antibiotics. So during the course of this, I found that there's always been drug-resistant pathogens already. The most well-known of them are called MRSA and VRE. A dual concern for me, what I think, is that one, the aging baby boomer population will lend itself to a growing patient population, as well as the threat that hospitals already provide the perfect place for the emergence and spread of antibiotic resistance. So since we're talking about antibiotics, I went ahead and did a little research on the actual sales. Even though there's not a lot of research and development out there, what are the antibiotic sales? And I found that even though the antibiotic market doesn't constitute much, let's see, it's the antibiotic market generated sales of $42 billion in 2009 globally, representing 46% of sales of anti-infectious agents. Now, anti-infectious agents don't necessarily include just pharmaceuticals. It's any anti-infective agent. But over the last 5 years, the antibiotic market has demonstrated an average percentage growth of around 4%. So, if resistance to antibiotics is driven by their misuse and use, misuse especially confers increased resistance to because the pathogen is never fully eradicated, and it can cause an immunity to the antibiotics presented. So hopefully the increase in antibiotic sales will closely follow the dollars spent on research and development to maintain the pace with an ever-growing pathogenic enemy. So from there, there's a couple of bits of legislation that have been introduced, notably PAMTA and the STAR Act. Both are pieces of legislation which are concerned with the strengthening of government control on the use and overuse and misuse, of course, of antibiotics, especially especially with the use of antibiotics on livestock. Evidently, antibiotics used on livestock has been directly linked to the spread of MRSA in some countries because the livestock have been infected with it. They've been given these tons of antibiotics, and their bodies become more and more resistant to infection. The pathogens become more and more resistant to the antibiotics. So, they basically developing these superbugs and then pass them on to their human caretakers and then even the hospital staff. So it's pretty dangerous, all of that. Let's see here. So, also a couple of countries have actually introduced legislation. Mexico has begun to crack down on the illegal use of the illegal sale of antibiotics in response to the growing problem and threat of drug-resistant infections. Also, Brazil is trying to introduce legislation to also prevent the sale of antibiotics without a prescription. So there's quite a bit going on here. I know that this vlog wasn't originally intended to discuss. I know that it was basically intended to discuss pharmaceutical sales, but if a company is more concerned with profits rather than research and development, a disparity can evolve, between the actual need for new antibiotics and a company's bottom line and the investors involved. So hopefully, the biotechnology companies, that's my dog, sorry about that, companies will continue to, she always barks like that when it's strangers, so sorry, carry the torch, hopefully the what the hell was that? So hopefully the biotechnology companies will continue to carry the torch of research and development, and the creation of new antibiotics will match the growth of sales. So other than my dog freaking out at the very end of this, I hope this presentation went all right. She still seems a little freaked. I think I've got to go now and figure out what is going on with my dog. So thanks a lot. This is Jeremy Pauls coming to you kind of live from New Orleans, and thanks a lot. I'll talk to you soon. I'll be posting.